Today on Dream Dental, we will be answering how much does the all-on-4 procedure hurt? How much pain am I going to be in? I get this question quite a bit, and I can honestly say that what I can promise you is that my patients will always say that it hurt or it was less painful than what they expected. I have patients that often will say they were in zero pain. I had a patient just yesterday that came in and said, I was in no pain. To me, even as a doctor and even with everything I do, I'm amazed at how the body heals. But everybody is different. I tell people if you bruise easily and if you take a lot of pain medications, then typically you're going to probably be in more pain than most patients. So what we do at Dream Dental is we actually use everything available to try to control the patient's experience. So this actually starts 3 days before. So we put patients on an antibiotic to control the chance of having any infection. The second thing we'll do is we'll actually start patients on non-steroidals, a type of medication that actually will cause less inflammation post-surgery. The day of surgery, we run an IV and we do sedation, so we control the experience so the patient doesn't even feel any injections, doesn't feel any pain. The day is literally a dream to the patient. And then after surgery, we will push medications to control the pain also. And then we put them on a very strict protocol with ibuprofen and Tylenol. And for some patients, we will prescribe medications, narcotics, not something that I'm really narcotics is not something that I try to push on any patient. But I do feel like they have a certain place when it's appropriate. But my patients typically will say when they come back a week to 2 weeks later that they're doing very, very well. They're in little to no pain within 1 week to 2 weeks. A question I often get to is how quickly can I get back to work? And I would say for most people, 3 to 4 days recovery will be plenty. If you're not doing anything that's really difficult, if you're not lifting a lot of weight or doing something really strenuous, you actually could probably go back to work the very next day. I have patients that will work literally the next day. I just think in the first 36 to 48 hours is when the body is going to respond and swell or have some inflammation. And so you want to keep your heart rate down so that you don't increase any more swelling or inflammation. If you have any questions, please leave them in the comment section below. Thank you for watching. We'll see you next time.